A milestone in New York City when a New York City nurse at Long Island Jewish Medical Center received the first COVID-19 vaccine. Hello, I'm Carla Winfrey.
And I'm Carolyn Sawyer, and we're happy to have you with us today on the Health Wrap. We've got a lot to cover as we talk totally about vaccinations today and this vaccine and the discussion around the vaccine. Shortly after the nurse received the first shot, a few days after actually, we had the vice president and the Surgeon General, Jerome Adams, actually take the shot on live television as well. We're being promised that 3 former presidents will also take the vaccine in a public setting so that the people can see that the vaccine is safe. That's the big push that everybody's trying to get across, Carla, as we look at what has become a historic move with the vaccination coming to market in less than a year.
Absolutely. And here's the comparison of the COVID-19 vaccine. We've got Moderna is working with the National Institute of Allergy and Infectious Diseases. And according to Science Magazine, Moderna's vaccine trial has a 94.1 efficiency rate. Moderna is projected to have 500 million to 1 billion doses produced globally. And then we have Pfizer and BioNTech. They're working together to develop a COVID-19 vaccine. And Pfizer released trial results which show their vaccine has a 95% efficiency. They plan to produce 1.3 billion doses by the end of 2021.
And then, of course, there are a number of other companies that are also in the race to come up with a vaccine that can be useful to the United States and to curb the death toll that we continue to have. You can see some of those other companies that are listed: Novavax, AstraZeneca, Johnson & Johnson, Sanofi, and GlaxoSmithKline, mouthful there. But several other companies that are working on the vaccine that will hopefully end this death toll that we keep seeing go up and up and up. And we were warned. We were warned by the CDC that the winter months would be bad. This January, February would be really tough. And it has, in fact, taken its toll. It seems like daily you pick up and the stories just tear at you. One seems worse than the other, and then you hear of another. But it's not slowing down. We also knew that the holidays would put some pressure on the system. You've got ICUs out in California that are totally full as a result of patients that are looking for treatment.
And there's so much skepticism in the Black and Brown community around the COVID-19 vaccine. The Pew Research shows only 42%, Carolyn, of Black likely to get vaccinated, compared to 63% of Latino people and 61% of whites. And Carolyn, this is Docs on Call with the Health Wrap. And Dr. James Hildreth, the president and CEO of Meharry Medical College, was the first physician that we had on the Health Wrap. And we had him on the show last year at the onset of COVID-19. And he is a global infectious disease scientist as well. And this is what he had to say about people who are hesitant to take the vaccine.
Well, the things that are happening all around us that we can see with our own eyes really mandate that African Americans and people from Latinx communities, we need the vaccine more than anyone does because we're bearing the burden of disease and death. There's a fully justified apprehension on the part of those communities about medical research, given all that's been happening. In fact, you can go all the way back to 1619 and see the atrocities visited upon Black bodies in the service of medical research. But we have to get beyond that, and I think it's now fair to say that human subjects research is totally different than what it was back in the 70s when the Tuskegee experiment ended. And there are lots of protocols and safety things put in place to allow us to safely participate. And so I think what I would say to our community is that it's understandable that people are reluctant and have apprehension, but if we don't get vaccinated, we're going to be continually suffering the brunt of this disease and death, and we can't accept that. It's our responsibility as medical providers and scientists to provide enough information to people that they can make an informed decision, because we want them to have agency. We want people to have the ability to make a decision to take the vaccine, but only after they fully understand everything that we have to share with them. So that's what we're trying to do. And that's going to require trusted messengers, Carla. And that involves faith leaders, community organization leaders, and hopefully folks like me who lead organizations like Meharry. And I think we can get it done. I really do.
Bioimmunologist Kizzy Mika Corbett is a lead vaccine developer, and she says, as a woman of color, she wants to help restore trust in the Black and Brown communities. She is our beautiful scientist, brilliant, who is the key scientist behind the COVID-19 vaccine.
Beautiful and brilliant, a North Carolina native who actually is at NIH and actually was part of the Moderna vaccination that they developed. There has been an African-American man who has been part of the Pfizer project, and I know that we've met him through some interviews as well. I don't think it's any accident that we are seeing the rollout that includes high profile people of color, because I think that's how deeply entrenched the skepticism is. And so there's a great deal of attention that's been placed. Another point that a lot of people have harped on has been how fast that the drug was turned around. And we talked with South Carolina's state epidemiologist, who's Dr. Linda Bell, and she said we really shouldn't be skeptical about that.
I really understand that hesitancy because of the history. But what I want to emphasize is what we learned from that history and why why the scientific community and manufacturers put into place certain things that are required now for clinical trials, that there must be oversight, that there must be patient consent, that there must be, there's a duty to do no harm. So all of those things that historically were not in place are in place now. And some of the hesitancy is over the fact that the perception that we were able to develop the COVID vaccine very, very rapidly. But I want to emphasize that doesn't mean that any steps were skipped. In the same clinical trials process, and even early on, we benefited from having the genetic code for this virus very early. So what the public sees in terms of how quickly it came to market, they may not recognize that we really had years of experience from the first SARS outbreak and months of experience developing these vaccines, and that no steps have been skipped in assessing the safety or efficacy. And I understand that some communities of color will question that. But the other point that I would emphasize is that our communities of color are being disproportionately impacted by COVID and by flu because they have a higher tendency of having underlying medical conditions. So it would really be to our benefit as African Americans to really take advantage of these tools and to and to get over that hesitancy. This is something that is proven to be safe and effective through the clinical trials, and we really want people to take advantage of that to protect themselves, protect their loved ones.
So Dr. Bell, I think, offered some really great insight into why people should not be as skeptical as they are. But we wanted to know what people in the community actually thought, and some of our viewers, and we often ask questions about what people think on Facebook. And the question we put out there was, should every U.S. citizen be required to take the COVID-19 vaccine? And Carla, you can see a couple of the reactions.
Yes, we had a Monique Reagan from South Carolina, and she posted, it should be a choice. A lot of people don't believe in receiving vaccinations for religious purposes. And medically, it should be a choice as well, because some people have underlying conditions in which this vaccine may trigger complications.
The next response that we got from an individual was Suzanne Woolley, who said, even though I believe everyone should be fully vaccinated because I believe in public health, no, it should not be mandatory. I think if employers want to require it to work in the office, I'm okay with that, as long as they accommodate those who don't get it with remote work availability. Interesting point.
And Yaya Smith of Louisiana said, if a government can force you to intake something into your body, that is just the very top of the iceberg. We have to draw the line somewhere and remember that this government has not always been honest and trustworthy. in their handling of the public. So we want you to please join in the conversation.
Absolutely. And a little bit later, we've got some lawyers who offer some thoughts on what some of the legal issues might be concerning. We want you to join in the conversation as well. So you can go to our website and voice your opinion and plug it in, even as you're watching the show right now. There is a concern about the timing about this vaccine, and many say that could be some of their problems. We want to let people know, though, if you are sitting at home and wanting to get the vaccine, there is a way that you can find out where you can get it. Here's a resource we wanted to share with you. It's called thevaccinefinder.org. You can bookmark this site, as it will tell you where the vaccine will be available to you. And Carla, we know that what we're hearing for the general public, it might not even be until the spring that this will become an issue. The CDC recommendation was that the first individuals that would receive the vaccine would be those on the front line who were dealing with patients that had COVID. We've actually seen, as we showed at the top of the show, government officials that are kind of next in line getting the vaccine. And then we have our seniors that are in nursing homes as well getting the vaccine. So there's some steps that we're going to go through before it becomes available to the general public.
And we will be back with more about the vaccine right after this.
The COVID-19 pandemic has changed our lives, but one thing that hasn't changed is the need for routine vaccinations. Vaccine-preventable diseases like measles, flu, and pneumonia haven't gone away and can cause serious illness. Protect yourself, your family, and those around you by staying current with routine vaccinations. Talk to your healthcare professional and stay up to date on all recommended vaccines. Learn more at www.nfid.org.
As doctors, we know African Americans are more likely
to acquire and die from complications of the COVID-19 virus.
Why?
Because people of color suffer from higher rates of chronic medical conditions.
Like diabetes and obesity.
High blood pressure,
heart and kidney disease,
and asthma.
All of these lower our immune system and the ability to fight off viruses.
Being an essential worker and even using public transportation increase the risk of getting COVID-19.
But we can better protect ourselves and others from the virus. Washing your hands,
not touching your face,
wearing a mask in public,
social distancing,
eating better, exercising, getting more sleep,
and visiting a primary care provider for health checks.
Will all make a difference.
If you have questions, call the number on the screen.
And visit our website.
Let's work together to save lives
and beat this pandemic.
So how did we get here, Carolyn? Today, we're going to take a look at the history of vaccines then and now.
There goes that 54% statistic on African Americans not taking the vaccine. I tell you, that's higher than the earlier one from the Pew Foundation. The most important thing, and I think you and I have been saying this since we started this endeavor in March of last year, and that is that people need to get all the information. We decided to come up with some facts so that people could use the facts to calm their fears. You get all the information, and then you have to decide as a family what is the best strategy and approach for your family, and how do you go about doing that? I mean, Carla, you're in Nashville, I'm in South Carolina. I think I looked the other day and Nashville was like at the top of the list for cases. You've got to get all the facts and then decide what works for your family.
And you've got to think about more. You're right about family. You've got to think about more than just yourself, because you can say, well, I'm going to be fine. I don't need a mask. I'm 25 years old. But you still can be, as Dr. Hildreth told us last year, a vector, and you can carry something to your elderly grandparents, and you may feel fine, but next thing you know, they're sick, they're in the hospital, and then they've passed away. So you're right. You have to take a personal responsibility and discuss what's the best for your family, and individually you have to remember that you may feel fine, but you can still be a carrier of COVID-19.
And I think about our own situations, different states, but both living with elderly parents. And so while they're not in nursing facilities, nursing homes, where the big chain drugstores are now responsible for diagnosing or actually delivering and providing the vaccine for those in nursing facilities, that then raises the question: do you let them know? My father, for instance, who's a veteran, I've already gotten the emails from the VA and information about whether or not they'll have doses available. So again, it really comes down to getting all the information, looking at your current circumstances, and determining, is that the safe route for your family to go? Because the debate is one that I feel certain will be raging on for a good little bit. And again, we're not expecting to start seeing vaccinations until probably early spring at best, based on what we're hearing about the amount of dosages that are available and getting past the first wave. I thought it was interesting when I talked to Dr. Bell. She wasn't even necessarily sure that South Carolina would get enough dosage in the very beginning to cover all of the frontline health workers. So again, this is a conversation that's going to continue for certainly a few more months.
I also found it interesting as I was talking to and listening to attorneys that there are healthcare workers. Some of them are saying that, well, I don't know if I want to take it yet. But a lot of hospitals are saying, well, we can't make you. And then some are saying, yes, you have to take it, especially if you work in that COVID area and if you're one of those frontline workers. So it's a lot more that because this is something new, and people, as the vaccine is something new, that there's still a lot of, we're going to have to wait and see what happens as far as with laws, with employers, and with people making that decision. I've heard one friend of mine who said, I'm not going to do it. And then yesterday told me I went ahead and took it because it made sense. Why am I going to put myself out there like this? And we really are not, like you said, national, you saw it all lit up and all red. So it's like, I need to protect myself.
It's interesting. We've talked about it before on the show, how much I travel. And overseas, there have already been discussions by some airliners as to whether or not they will get to a point where they say, if you've not been vaccinated, you can't fly on that particular airline. Not there yet, but discussions about that, which will, again, for those who are frequent business flyers and have to do business in different parts of the country or the world, there certainly then becomes less of a discussion and something that you would seek to do in order to be able to remain as mobile as you are. So again, it comes back down to personal decisions. But the one thing that everybody is trying to do, and that is to get at least, I think it's a 70% participation, because at that 70 percentile that we're talking about, what they call herd immunity. And that means that the majority, but the short line, and you might say it another way, but the short line is if you get the majority of people, then you should be okay that you don't have the other 30%, but you got to get to 70%. How would you explain the herd immunity?
Well, it's something that we've heard a lot about. And when the coronavirus first started, that causes COVID-19, we first started to spread, virtually nobody was immune with no resistance. the virus quickly spread across a lot of communities. Well, when most of a population is immune to an infectious disease, this provides an indirect protection, or what is called the herd immunity.
Well, we'll talk more. As I said, people are going to hear more about herd immunity. It's going to become probably a new word, a new vocabulary word that everyone's using. We'll hear more, though, as we continue our conversation about vaccines. Stay with us.
Flu season is here, which means coughing, sore throat, aches, fever, and time off sick from work and school. But you can protect yourself.
Get vaccinated. The flu vaccine is safe and effective for preventing the flu.
Wash your hands with soap and hot water often. The flu spreads from close contact with others infected with the virus. If you're sick, stay home. Don't spread the flu to others.
I'm Dr. Amy Acton, Director of the Ohio Department of Health, and I'm here to remind you to get your flu vaccine this year.
Get vaccinated, Ohio.
Our lives have been turned upside down by COVID-19. When a vaccine becomes available, it's critical that all of us get it. What we do as individuals will impact everyone's health, including those who can't get the vaccine. We won't get through this unless everyone takes part. Now is the time to get up to date on all recommended vaccines for both kids and adults. Experts say it's more important than ever for everyone to get their flu vaccine this year. And if you're older, you should get both the flu and pneumonia vaccines, since both illnesses can make COVID-19 even worse. Vaccines are available at a lot of convenient places, so be an example for friends and loved ones and encourage them to get vaccinated too. We all want to reunite, travel, and get back to school and work. But that means we all need to get on board. This is the time to do what's right for each other. Get vaccinated. It's our best shot.
So, Carolyn, I like to listen to a lot of attorneys for some reason talk. And right now, this is a topic that's a hot topic among attorneys because there are labor attorneys and employment attorneys. And they're talking about, because people are asking employers and employees, do I have to take this vaccine? So I listened to different attorneys from around the country, and here's what they had to say.
We already know people are balking at getting vaccinated. They don't trust it. We hear that. So it's going to be a problem. But you know what? If you want to work and your employer has a responsibility to others, you're going to have to confront the reality that you don't necessarily get to make that rule. And if you're that unhappy with it or unprepared to deal with the vaccine, perhaps you should look elsewhere.
There may be some people with objections to the vaccine because of religious reasons or either medical reasons.
We do know from the EEOC guidance from last spring that a job offer can be rescinded, that a job offer can be tabled pending, varying scenarios involving COVID testing, COVID status, and quarantine status. This is uncharted in, the strictest way of looking at it.
It's not the same for every workforce, but if the employer knows of something that will help motivate employees, something that's motivated them in the past to do something they may otherwise not have been willing to do, they can certainly go for that.
Employers, as they have for the past 8 months or so, really trying to balance understanding all the available information and what their rights are as a company to continue to engage in productive business, while also wanting to make sure that they have created a safe work environment for the employees that they're asking to come back.
So basically, there's a lot of questions still up in the air because we've never had this before. And they're trying to see, how is the government going to move, like each state, each country, and they're just trying to figure it out.
It reminds me, I checked in a couple months ago on a classmate, Keisha Lance Bottom's husband. If you recall, the mayor of Atlanta, as well as her husband, had contracted COVID. And I remember, he's a lawyer. One of the things he said to me, though, he said, Carolyn, when I go to the doctor, They know no more than the last patient who was there like 1 month ahead of me, who had it 1 month before me. And so all of this has been a learning curve. What's been cool, and we really have to take our hats off to the scientists in all this, the frontline medical workers and the scientists, because the doctors have gone in and since March of 2020 have figured out what are some of the new practices and procedures for treating people. So we're seeing some better outcomes. You're not seeing the cry for respirators because some of them just figured out something as simple as turning a patient over and putting them on their side. So they're discovering new things in terms of how to treat. It's still not curbing the death count, which is sad, but there are new things that are discovered every day. And what we have to take our hats off to is the fact that in less than 1 year, they came up with not one, multiple vaccines that can be used and given to those on the front line. So that, congrats to our scientists.
Like I heard one scientist last night, and she's actually African-American female. She says, let me just break this down to you all. She said, it's not like we just didn't have a recipe. She said, we've already had this recipe and it's like making a cake. We've worked on this recipe over and over, and now it's time to bake that big final cake. And it's not like, oh, we just started working when the vaccine, when COVID started. We have been working on these things, and now it's time for us to put this out to the public. One thing that I did learn as listening to different scientists talk about the vaccine is how two parts of it. One recognizes that something's wrong, and then one is the fighter. So one is kind of like, okay, I'm at the door saying something's going wrong here. And then the other part of it jumps out at you to actually fight the infectious disease.
The other thing we're continuing to learn, and we'll continue to obviously watch and monitor here on the Health Wrap, is side effects and the after effects of this virus. I'm hearing from people who say that they're still fatigued, that in some instances they're seeing some of their bodily organs that are in a little disrepair after having gone through it. So we'll be following that, but as we leave today and as we wrap up this show where we've looked at vaccinations and vaccines and the history of and the skepticism about, we certainly have to take our hats off to some people who have been working night and day on the front line treating patients, but also looking for a solution. So great time just looking at the history, looking at the skepticism, but hopefully giving people some information to help make some decisions that are the right decisions for their family.
Absolutely. And Carolyn, this is the beginning of the year. We have a lot in store as we look at health disparities going in as we start 2021. So we'll be telling stories, people's stories, talking to our physicians, and talking to you as well.
Absolutely. Well, until the next time, make it a great day.
Docs on Call is proud to partner with the W.K. Kellogg Foundation, Gwen Ifill College of Media, Arts and Humanities at Simmons University, along with the School of Social Work, the Program in Public Health, and the President's Advisory Council on Diversity, Equality, and Inclusion.